How do you know if you'll die from heart disease? It turns out the size of your arm can tell you a lot more about your health than you realize. Here's how arm size can determine whether you'll die from a heart attack. Size matters. What does arm size have to do with your heart? Well, it seems that the size of your arm may reveal whether you will survive a heart attack. A recent study published in the American Journal of Cardiology found that the bigger your arm muscle is, the less likely you are to die from heart disease. Researchers studied 600 older adults with cardiovascular disease. They measured the circumference of the participants' mid-upper arms and calves, since these areas determine muscle mass. Researchers also studied the participants' muscle function through gait, speed, and grip strength. During a follow-up period that averaged about 1.5 years, researchers found that 72 of the adults aged at least 65 years died. However, the participants whose arms had a higher circumference showed more positive outcomes. Data suggests that both measurements are associated with the chances of dying of heart disease. But the researchers found that only arm circumference showed significant independent prognostic capabilities. Researchers concluded that people with larger arm muscles compared to calf muscles were more likely to survive a heart attack. Furthermore, researchers concluded that a simple measurement of the arm could determine risk factor of heart disease in older patients. Muscle deterioration seems to be to blame. Here's the thing, for many people, particularly seniors, staying physically active can decline with age. In fact, when older people lose muscle mass and strength as they age, it's referred to as sarcopenia. According to research from Johns Hopkins University School of Medicine, sarcopenia can result in a number of factors including hormonal changes, less physical activity, chronic illness, neurological decline, and of course, poor nutrition. Sarcopenia leads to frailty, increased insulin resistance, fatigue, and falls. It can also lead to chronic diseases like diabetes and rheumatoid arthritis, and even death. Therefore, arm muscle is a marker for a healthy and fit body, which accounts for why those who have larger, more muscular arms are less likely to die from a heart attack. So it's no wonder then that exercise along with improved nutrition could help tackle muscle deterioration. So get moving. The World Health Organization estimates that 17.5 million people die each year from cardiovascular disease, which accounts for about 31% of the deaths worldwide. And 80% of all cardiovascular disease deaths are due to heart attacks and strokes. Engaging in physical activity for at least 30 minutes a day each day will help to prevent heart attacks and strokes. The American Heart Association recommends strength training at least 2 times per week. Strengthening your muscles allows you to perform everyday activities more easily and of course helps protect your body from injury. Stronger muscles can lead to a boosted metabolic rate. That means you burn more calories even when your body is at rest. So regular physical activity can help those who have already had a heart attack too. Although some people are afraid to exercise after such a devastating event, regular physical activity can actually help reduce chances of having another heart attack. In fact, in 2014, the American Heart Association published a statement suggesting that doctors should prescribe exercise to stroke patients. According to them, there is strong evidence that exercising after a stroke can improve cardiovascular fitness. So just start walking, do some strength training, and you'll improve your overall just heart health. So what are some signs you're having a heart attack now that we're talking about it? Not everyone experiencing a heart attack has the same symptoms or even severity of symptoms. Some people may experience mild pain while others more severe pain. Additionally, some people have no symptoms at all, and the first sign may be a sudden cardiac arrest. However, the more signs and symptoms you're experiencing, the greater likelihood you're having a heart attack. Some common heart attack signs and symptoms include feeling pressure, tightness, pain, and aching sensation, or a squeezing in the chest or arms that can spread to the neck, jaw, or back. A feeling of nausea, indigestion, heartburn, or abdominal pain. Experience shortness of breath, cold sweats, feeling fatigue, feeling lightheaded, or sudden dizziness. Don't wait too long. If you think you're having a heart attack, of course, don't hesitate, act immediately. Call 911, etc. Some people that wait too long because they don't recognize signs and symptoms, then you can end up in a worse off position. If you don't have access to emergency medical services, then have someone drive you to the nearest hospital. If nitroglycerin has been prescribed to you by your doctor, take it as instructed while awaiting emergency help, says the Mayo Clinic. Or, if recommended by your doctor, take aspirin while waiting for help to arrive. Taking aspirin during a heart attack could help reduce heart damage by keeping your blood from clotting. However, don't take aspirin unless your doctor or emergency medical personnel recommend. Take steps now to improve your health. The bottom line is there are many factors that come into play in whether you'll have a heart attack or not, including your genes, what you eat, and how much you exercise. Arm size is relatively new science that acts as a marker of good health. But nothing is written in stone. If you take steps now, you can greatly improve your chances of not having a heart attack. Through healthy eating and exercise, you can increase your muscle strength and arm size. And that could mean preventing your ticker from turning into a time bomb. Thanks for watching. I'm Nick with the Health Report. Hit that like button and subscribe to my channel for more information.